Hi, in this video, we're going to talk about how sitting can actually contribute to your pain or even possibly cause your pain. We're going to talk about why and what you can do about it.
Okay.
So, I know that I actually had pain with sitting when I was working on my doctorate. I was sitting all the time. And it was that chair. It was the chair that I was sitting in. It was an old chair and it had cushion, but it didn't have enough cushion, and It was causing me pain. So sometimes it can be as simple as, what you're sitting in.
Right.
I don't know. Have you had any problems with sitting?
Well, I did have problems. Sometimes I narrate audiobooks. And so I was sitting, but it wasn't the chair. It was actually the way that I was sitting, and I was leaning forward into the microphone. And that was kind of causing all kinds of problems.
Yeah, so you can have a great chair like this, but if you're not using the back support, it's not going to do a whole lot. So now why? We'll start at the beginning. Why? Why does that cause pain? Well, our bodies are held together by our muscles, ligaments, and joints. And if we hang out too far one way or the other from what we call neutral, we can put a lot of stress and strain on those structures. And then just by sitting too much or just not getting that blood circulating enough. So any posture that you're in for too long is just not going to feel that great, especially if you're dealing with any kind of pain, or if you're pregnant or postpartum, that you are going to be sitting a lot feeding that baby postpartum. We're going to talk about that in a few minutes. But you have a lot of changes going on in your body already. So to be aware of what's going on when you're sitting is really important.
Okay, so what can we do about it?
So the what can you do? So this is a theme. I don't know if you noticed.
Is it awareness?
It's awareness.
Yes!
We have to be aware of how we're sitting. So I'm sitting here, not even, in a chair with a back support. But if I'm not aware of my posture, I can be sitting with that whole slumping that we were talking about a few videos back. We want to be aware of our pelvis. So the awareness comes in, what is our pelvis doing? Because if we can get this correct, or better, then it's going to be better because our body follows the pelvis. So if our pelvis is tipped back, our head tends to go forward.
Wow.
And if our pelvis is tipped forward, we tend to have a nice arch in our back. So it's pretty much that whole anterior, posterior tilt that we talked about in standing, and that actually feeds into the slump. So being aware of how we're sitting, we want to sit on our sit bones. So our sit bones, are the bones right at the bottom.
Okay.
So you want to lean forward in your chair and scoot your hips back. So scoot them back. And then you're going to think about pulling your cheeks out actually and sitting wide so that you're not sitting tucked in, especially if you're having any tailbone pain or pain at the bottom.
Yeah.
So you're sitting and you come back up and you're actually perched on your pelvis. And that's kind of where you're meant to be.
Okay.
Does that feel different?
No, it definitely feels good. And it makes sense that you don't want to sit narrow, that you want to use the entirety of your pelvis to
and the entirety of your buttock.
Yeah.
Entirety of your buttock. So what therapists call sacral sitting, you want to avoid. This is your sacrum. And if you sit like this, it's called sacral, us therapists call it sacral sitting. And that's, you can do it once in a while, you can do it if you're whatever, but if it's a habit, it's these habits that we want to avoid. So thinking about your pelvis and where it is, using a back support if you have one. If it's a straighter back chair, that's going to be different than having a chair like this.
Yeah.
You can use a towel roll if you need to put a little bit of support in your back. I know on my couch, I feel more comfortable if I have a pillow and a small on my back. And you can just use a towel to do that.
Wow.
One thing that I really found that
feels
people,
nice.
because it depends on your chair whether or not you need support.
Yeah.
It depends on your back too. So one thing I have found that people that are sitting at the computer a lot, they tend to lean forward to see the screen. And then they're not using their back support, and then it's causing them pain. If they're already having hip pain or groin pain, that it's causing more. So
Wow.
being aware of how you're sitting, the chair you're sitting in, and whether you're using a back support, feet on the ground. I just treated somebody that was short and her feet didn't hit the ground.
Right.
And I realized, I'm tall and you're tall, so we never have that problem. But if you are short, putting a footrest on the floor so that your feet can be up, so that you're not having all that pressure in the back of your knee.
Yeah, that makes sense.
And it makes it much more comfortable.
Mm-hmm.
Do not sit too long. That is a big thing. Get up, move around if you can. Breastfeeding, I think we're going to just do a whole nother video on bottle feeding and breastfeeding, because it's not going to pertain to everybody, but I've got some tips for you on that too. So stay tuned and we'll do that on our next video.
Sit well.
Sit well.